Welcome to this short video to introduce the M-Warmer IV fluid warmer. Fluid resuscitation is not without its risks. Too much fluid volume or infusing fluid that is too cold can contribute to the lethal triad, impacting the clotting mechanisms, acidosis and hypothermia. Our aim is to prevent and manage hypothermia with blizzard bags, sleeping bags, exogenous heat through the ready heat blanket, etc., changing wet clothes for dry clothes, whilst concurrently administering fluids to restore the radial pulse and mitigate shock. Both the Tactical Combat Casualty Care and the Wilderness Medical Society guidelines recommend the use of warmed IV fluids between 38 and 42 degrees Celsius. And the next section of this video will be a quick introduction to the component parts and characteristics and how to set up the IV fluid warmer to deliver warmed fluids to your casualty. The M-Warmer starter kit consists of 3 component parts: the charging unit with various international adapters, the power pack, and 5 disposable IV fluid warmers. As you'll see, the kit is lightweight, easy to set up, and can achieve the target temperature of 38 degrees Celsius almost instantaneously. With the battery pack, the charging unit, and 2 disposable fluid warmers, the kit weighs 1.2 kilos. The battery pack can be fully charged in 3 hours, and in winter conditions, a fully charged battery can heat 2 litres of fluids. Simple to set up. Remove one of the disposable IV warmers from the foil pouch. Remove the seal. Disconnect the luer locks. Connect the blue end of the IV warmer to the cold IV fluid giving set. Prime the M-Warmer by opening the flow wheel on the IV fluids. Run the fluid all the way through the giving set and through the M-Warmer out the other side, and then turn off the fluids. Remove the protective film to reveal the sticky back membrane and attach that to the patient. If the patient is in shock, sweaty, or has got wet skin, you might need to use some duct tape or elasticated bandage for extra security. Then we're going to connect the distal end or the red end of the M-Warmer to the patient, to either the IV or the IO access, either directly or with a flexible connector tube. Then we'll connect the power bank to the M-Warmer, and the green arrow illuminated points towards the patient, indicating the direction of flow, and a green illuminated light indicates that the fluid is being warmed to 38 degrees Celsius. Once connected, you can open the flow and start your fluid resuscitation. In our case, a bolus of 250 millilitres of normal saline solution, and then hold fluids and recheck for the radial pulse, repeating if necessary to re-establish the radial pulse. Finally, the operating parameters and technical specifications can be found in the user manual, but it includes things like RF output, battery capacity, operating temperatures, etc.